back to another video. In today's video we are going to talk about cesarean section or C-section, and in this video is where I'm going to talk about care of the wound after cesarean section. So cesarean section is a surgical procedure used to deliver a baby when a vaginal delivery can't be done safely. A cesarean section can be planned ahead of time or performed in emergency. It carry more risk than vaginal delivery with a slightly longer recovery period. So let's define cesarean section. A cesarean section is also called C-section or cesarean delivery. It's a surgical procedure in which a baby is delivered through an incision in the abdomen of a woman or the uterus. The abdomen and the uterus, not all. The abdomen and the uterus. The abdomen of the woman and the uterus. Now, they are performed when a vaginal delivery is not possible or safe, or when the health of the woman and the baby is at risk. So I know you are asking, when would I need a cesarean section, or in short, who is at risk of getting a planned cesarean section? So you may need a cesarean section if you have a certain medical condition, or if you have complication occur during labor in vaginal delivery. So a planned cesarean section happen when the following, what I'm going to say, a condition exists. So number one, if a woman is having cephalopelvic disproportion or CPD. This term means that your baby's head or the body is too large to pass safely through your pelvic, or the pelvis is too small to deliver an average size of the baby. And number two, if you have a previous cesarean section. Most of the people usually say that they just say without knowing what it means. But when you have a previous cesarean section, subsequent delivery, most of the time the doctor will always recommend for you a cesarean section. This is because sometimes the vaginal delivery wouldn't be possible according to maybe you had a cephalopelvic disproportion, or maybe how the cesarean section was done last time was not done properly. Although it is always possible to have vaginal birth after previous cesarean section, and it is optional for everyone. Yeah, it is optional for everyone. If you want to have vaginal delivery after cesarean section, after previous cesarean section, you can choose to do so. But factors that can affect this include the type of uterine incision used in the previous cesarean section, and the risk of uterine rupture. Maybe you got pregnant when the wound has not yet healed very well. Then with contraction during labor, you might get uterine rupture. So at this point, the doctor can recommend cesarean section. And also when you are carrying multiple babies, the doctor can also recommend cesarean section. Twins, sometimes they always deliver them through vagina, but most of the time, if you are carrying 3, 4, 5, most of the time, it is always recommended that you do a cesarean section. If you have placenta previa, this condition is whereby placenta is attached too low in the lower uterine and block the baby's exit through the cervix. Yeah, that is what placenta previa means. So another one is transverse lie or oblique lie, or if you have bridge presentation. All these lies and presentation can make you have a cesarean section. Also, if you have a health condition that especially if you are having heart diseases, you can put yourself, or the condition can put you at risk of getting cesarean section. Or maybe if you are having genital herpes, according to the status of that herpes, then you can have a cesarean section after assessment has been done and the doctor knows the condition of that genital abs. Another thing that also can put you at risk of getting a cesarean section is obstruction. A large uterine fibroids can make your doctor to decide that you must have a cesarean section, so that at this time they also remove the fibroids. When you are giving birth, or when they are doing the cesarean section, they remove the fibroids. And that one also, maybe if you are having a baby with certain congenital abnormalities, this can be also a reason for a cesarean section. So unplanned cesarean section delivery might be necessary if any of the following conditions arise during labor. Number one, if labor is not progressing. This means that the baby, the labor is prolonged. The labor is prolonged, not the baby. The labor is prolonged. This means the cervix stop dilating, or the cervix is dilating slowly, or the baby stop moving down the birth canal. This time, in this scenario, you can have emergency CS. Also, when you are having a cord compression or cord prolapse, cord presentation, cord prolapse, you can have when maybe the cord is presenting before the baby, you can have emergency cesarean section. Placenta abruption is also another emergency, can also put a woman at risk of having emergency cesarean section. And also fetal distress is also another condition that is common when you have it at when you are in labor. You can have emergency CS here. And yeah, those are some of the factors that can put a woman to have a cesarean section. Now, also something that most of the women usually ask, what can I expect before a cesarean section? If you have a planned cesarean section, the following procedures will take place. These procedures that I'm going to take place. Now, you will have to sign the consent form for the procedure to take place. You will have to give the permission for the doctor who is conducting that cesarean section, so that that doctor can have full right and permission to perform the procedure. The next thing that will take place, the anesthetician will discuss option for anesthesia. In some hospital, they usually discuss the option for you anesthesia if it is an epidural or maybe spinal block, or numbs you form. I'm saying most often is an epidural, and it's always numbs the feet. And also they can decide they have general anesthesia. The anesthetist will discuss with you which type of anesthesia you will get during procedure. Another thing that will happen, you should expect, is shaving the pelvic area. That is also very important. Catheterization, you can be done it. They can do it in theater, or they can do it before. They can do it before the procedure, before they take you to the theater room. And also they will have to take vitals. That one is also very important, because the doctors, the nurses need to have baseline data. So they will have to take vitals. They will put IV fluid to run. They will insert IV needle. So that one is also something that you should expect. And they will teach you some complications that will might arise, and so many things. If you need an emergency CS, your obstetrician deliver your baby quickly, because either health of your baby or your health is at risk. So maybe at this time some of the factors they won't discuss with you, like discussing will be with the type of anesthesia you should get. That one will the anesthetician will just have to decide for them to save you and the baby. Immediately after cesarean section, distraction guide. Immediately after cesarean section, make sure you wear loose clothes and cotton underwears. Also ensure good nutrition, because just like any other wound, you need this to enhance healing. Another thing that you're supposed to do, gently clean the wound and dry the wound, and make sure that the wound is not wet at all cost. Take painkillers if you get pain, if for you just to relieve discomfort. Watch out signs of infection. You will be told those signs of infection in the hospital, so you might know them. So rest and have little exercise. Just have enough rest and do some little exercise, just taking shower, going to the bathroom. Those are small exercises that you can do. Avoid carrying and lifting heavy objects, because you will rupture the place. So avoid those ones. I will also avoid going to the gym or doing intense exercises. And also go for postpartum checkup, so that you avoid so that they get to know if you are progressing well or you need medical attention. The next one, I said they avoid wetting the place. I think I've reached the end of the video. This video I've really shoot it with a lot of stress because of a lot of distraction are around me, so just bear with me. I think I'm very clear. Even right now you can hear the noise in the background. Okay, anyway, that is how life is. Thank you for watching. Returning subscriber, thank you very much. If you have not subscribed, kindly subscribe. Tell me what you want me to talk about in the comment section. This is the next pregnancy series and reproductive health care video that I'm doing. So bye, let's meet in the next video.